Hi guys, hope everybody's having a good Wednesday. We are back and going to talk about something that came up, of course, today in the clinic. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're talking about knee pain, knee clicking, but there's no pain. So a lot of you may or may not have clicking. I was a swimmer. I have Rice Krispies in my shoulder. I can't lift my arms above the head without them popping like crazy. It's like snap, crackle, pop, 4th of July. I have no pain unless I do certain movements, which I don't do. It's playing tennis, and I hate tennis anyway, so it's not a big loss. But these are types of things that I don't want to say happen as we get older, because nobody likes to admit that they're getting older, but it is that. Now, I'm not saying you have to be older in order to have that. There are some younger children that have this. But what is it? What happens? Why do you get these things? So as you get older, this is why you find a little bit more in older adults than you do necessarily in children, is you start to have looser ligaments. So what happens is that the joint surfaces are not lining up as well as they should. And what happens is as those joint surfaces start to move, there starts to be air in there starts to be gases in there, very complex explanations that are needed that we're not going to go into. But those types of things are going to cause a lot of clicking and a lot of popping. Also, as you get older, the smoothness of your joint surfaces decreases. So the linings start to wear away. Most of your joint surfaces, or all of your joint surfaces, have some type of lining on them that makes them smooth, that makes them go nice and easy, and makes them move in a manner that doesn't cause clicking. Well, as you get older, that starts to wear away. They start to become a little bit rougher. Maybe you have a partial meniscus tear. Maybe you just have fraying of your meniscus. Again, you can have fraying and a partial meniscus tear and have no idea you have any pain, but would it cause clicking? Absolutely. Also, as we get older, we have some decrease in muscle strength. And as that happens, you can have a decrease in how your patella, which is your kneecap, lines up with behind that bone back there. So as that gets a little bit looser in there, that also is going to cause some clicking. So is it something to be nervous about? No, it's a natural part of life. Unfortunately, people only usually become aware of clicking when there's pain associated with it. So it may be starting to bother you a little bit, which is why all of a sudden you become hypersensitive to this clicking. But the clicking doesn't really mean anything. Yes, there are some changes to your joints. Yes, there are some changes to your joint surfaces, but it doesn't necessarily mean there's anything to worry about. What you do want to look for is are you weaker? Maybe your hamstrings aren't as strong as necessarily your quads. Maybe your foot is flatter and you need to get a shoe that will allow your knee to be in more proper alignment. As we do get older, and sometimes even as we're younger and the structural makeup isn't quite there, we need to have other things in our shoes, let's say, like orthotics that will assist us and assist the foot in being properly positioned. Once the foot is properly positioned, that will allow the knee to be properly positioned, which will then allow those joint surfaces to line up a little bit better, not creating as much cracking. But one of the things that I really heavily advise against is cracking things intentionally. It is not advised. So if you squat down every time your knees crack, don't worry about it. But don't maneuver your leg in order to make that pop, in order to make that crack. No matter how much relief it gives you, it winds up loosening those ligaments. It winds up loosening and actually worsening those joint surfaces, which then will cause even more cracking. So cracking may be something that's going to lead up to possibly some pain. But like I said, most of the people that we see here say, you know what, I think my knee's been cracking for a while, I don't know, but they're only here because they're having knee pain, and that's why they're noticing the cracking. But honestly, I can tell you, I lift my shoulders overhead every day, and it is just like pop all the time. There's nothing that I'm going to do to fix it. It's totally fine. So if your knee is cracking, pay attention to the structure, pay attention to your strength, make sure everything is aligned, meaning you have proper footwear, whether that requires orthotics or not. Make sure your hips are strong, make sure your core is strong, because if that is weak, that's going to also cause those joint surfaces to not line up correctly. I just hurt. Did you just hear my knee crack? It's because I was standing on it for so long, weight bearing in that straight position. You don't always want to stand straight with your knee because it will lock it out. It will force those ligaments to work a little harder, and then when you go to bend it, it'll crack as some of those gases release. You always want to make sure you're standing with some sort of bend in your knee. That allows the muscles to be active and not the ligaments. Really important point, most people I see stand and they're completely locked out of their knees. That's putting all of the stress directly on your joint surface and directly on the ligaments surrounding your joint, which is not good. You don't want to put really any stress on those ligaments and joint surfaces, but obviously naturally as you stand, that's going to happen. So you want to minimize that throughout the day. So locking your knees out really puts a tremendous amount of stress on them, causes some gas buildup, causes them to crack almost every time, especially for me. So you want to unlock your knee. You just want to stand with a slight bend in your knee and make sure that you have those muscles that are more active and you're not just standing there straight leg, relying on ligaments, relying on joint surfaces to keep your legs up. But don't worry if you have knee cracking. It's completely normal. It is something that happens as you get older. If it's causing you pain or it is painful, it is something to pay attention to. I don't care if it hurts only once. It is something to pay attention to if it hurts. If it's just cracking, just because it's cracking, not a big deal. Don't worry about it. If you or somebody you know is suffering from knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office, 215-997-9898, and we'd be happy to get you in. Thanks and have a good night.